that, do you know what is first aid? First aid is the immediate treatment of an injured or ill person before professional medical assistance arrives. There are three core principles of first aid. The first one is to preserve life, next prevent further injury, and lastly promote recovery. Having basic first aid knowledge is important because emergency can occur unexpectedly in any workplace, including laboratories. Other than that, we can save someone's life with immediate actions such as performing CPR, opening the airways, and applying pressure to control bleeding. And lastly, immediate treatment also minimizes injury impact throughout the recovery process.
For learning objective, by the end of this video, viewers will be able to learn about, firstly, identify hazard associated with chemical fume inhalation in the workplace. Second, recognize the signs and symptoms of chemical fume exposure. Third, apply the DRABC approach during an emergency. Fourth, demonstrate the correct response for an unresponsive casualty. Lastly, understand preventive measures to reduce chemical exposure incident.
Moving on to explanation of topic. What are chemical fumes? Chemical fumes is an airborne contaminant produced when chemicals evaporate, react, heated, or released during laboratory processes. They may exist as gases, vapors, or very fine particles suspended in the air. Examples of chemical in laboratory are chloroform, hydrochloric acid, and sulfuric acid. How do the chemicals enter the body? The first one is by inhalation, by breathing in contaminated air. This is the most common route. The second one is skin absorption. Chemicals pass through the skin. The third one is ingestion, accidentally swallowing contaminated food, drinks, or touching the mouth with contaminated hands. And the lastly is eye contact. Chemicals enter through the eyes and the surrounding tissues. These are the short-term effects of inhaling chemical fumes. The first one is eye, nose, and throat irritation. Next, coughing and breathing difficulties. The third one is headache and dizziness, nausea and vomiting, and lastly, skin irritation or burns. The possible consequences of severe exposure are lung damage and respiratory failure, loss of consciousness, damage to the liver, kidneys, or nervous system.
In this scenario, a laboratory student is handling volatile solvent. The fume hood is not being used and ventilation is poor, allowing chemical vapors to accumulate in the work area. My chest hurt. I feel dizzy. Are you okay, Laila? I'm feeling weak. I feel weak.
Oh no, someone's help!
Procedure here. Everyone stay back and to check the surrounding spaces. There may be a chemical vapor in this area. Farah, can you help open the door for vapor ventilation?
Sure, I will open the door and switch on vapor ventilation.
Ensure safe surroundings to avoid additional victims.
Are you okay? Can you hear me? We have unresponsive casualty. Can you help call 999?
Sure, I will call 999 now.
Yes.
Hello, this is laboratory emergency. We have an unconscious casualty following suspected chloroform inhalation. Yeah, she had been unconscious for 5 minutes. She had symptoms like headache, eye irritation, and dizziness. Yep, yeah. Okay.
The airway appears clear.
The area must be opened using held lid chin lid technique while checking for visible obstructions.
I'm checking for breathing.
Keep a steady rhythm of 30 compressions. You, call 999 and get an AED.
I'm calling 999 now.
Shock advised. Stand clear. Everyone, stand clear! Do not touch the casualty. Shock delivered. Resume CPR immediately.
casualty breathing is back to normal, the casualty should be placed in the recovery position.
Emergency services have been notified and they are on the way.
Chemical inhalation exposure can happen unexpectedly, especially in laboratories and workplaces where hazardous substances are handled. Knowing how to respond quickly and correctly can prevent a minor incident from becoming a life-threatening emergency. First and foremost, prevention is always better than emergency response. Before handling any chemical, take the time to read the safety data sheet and product labels so you understand the hazards and required precautions. Always wear the recommended PPE and use a fume hood when working with volatile or hazardous chemicals. By following these simple safety practices, we can greatly reduce the risk of inhalation exposure and create a safer working environment for everyone. On top of that, the first key safety message is recognition and initial response. As soon as someone begins experiencing symptoms such as coughing, dizziness, difficulty breathing, or irritation, they should be moved away from the source of exposure immediately. However, it is equally important that rescuers do not put themselves at risk. Before assisting the victim, always make sure the area is safe and wear the appropriate personal protective equipment. If possible, increase ventilation by opening windows or allowing fresh air to circulate to reduce the concentration of harmful gases. Next, provide the correct first aid. Start by checking if the person is responsive. Then ensure their way is open and monitor their breathing. If they are unconscious but breathing normally, place them in the recovery position. If they are not breathing normally, begin CPR immediately, focusing on chest compressions until emergency medical services arrive. Acting quickly during these first few minutes can make a significant difference in the victim's chances of survival. Last but not least, seek medical attention promptly. Even if the person's condition seems to improve, medical evaluation is still necessary because some chemicals can cause delayed health effects. When calling emergency services, provide accurate information, including the chemical involved, how long the person was exposed, and the symptoms they are experiencing. This allows healthcare providers to prepare the most appropriate treatment.
Chemical fume inhalation can rapidly become a medical emergency. By identifying hazards, following safe work practices, and applying the correct DRABC procedure, injuries can be minimized and life can be protected. These measures help ensure a safer working environment, reduce the risk of severe health effects, and improve emergency response outcomes.